Okay, so good morning, everyone. So this is an unscheduled extra portion of webinar. So we'll have to call it webinar 3, part 2, to avoid any confusion with anything else. So um, yeah, we decided that even though normally we were just repeating in this morning session what we did on the Thursday before, we decided that because we ran out of time on step B for the whole thing, we would just record this special one about the end of step B, which is called B3. And that is the one about what we are calling the 9 pathways. So this is previously in my book, this was called step 3. And I so nearly cut it out of my method because I found it so hard to teach on a 2-day weekend course, this particular section. So I nearly cut it out, but it has proven to be really interesting over the years. And I think that it has got some really interesting features. And also it allows you to understand the 8 extraordinary vessel section even deeper. So it's worthwhile persevering with it. So I will go into a text that I think is a brilliant link between the old and the new, which I just show it to you here. In case you haven't got it, this is absolutely amazing. Damon, have you got it? No.
No, it's in my list actually. Yes.
Yeah, this is worth bumping up in your list to getting it when you can get it. It
Great,
really
great.
is. It really is something else. I mean, look, it's thick. It's incredible translation. Uh, I'm going to be studying this next because there's so much information about the extraordinary vessels in here. This is the real kind of source of the extraordinary vessel theory that we use now, and in it, it's the in it Li Jizhen, who wrote this, who was the famous lakeside author of the Pulse. He describes the extraordinary vessels and the extraordinary vessel pulses, and the description is really detailed in here. And he's quoting from the Mai Jing, so it's an excellent, but it's really well described. The commentary is so good in this book. Um, so I'll be showing some sections from this book later. Okay, let me dive into my PowerPoint. Start the show. Okay, so the 9 pathways method. So this used to be called the 9 regions, and I've renamed it 9 pathways for reasons you'll see when I describe in this new text. It's nicer translation of what they're calling Ju Dao, or 9 ways or 9 pathways. Um, so B3 is this advanced form of part B or step B. And I think it picks up imbalances in the Luo collateral system. At least if it's not that, it is the sinews, and or it's excess findings of the primary channels. So it's basically something blocked in the channel system of physical nature, as if there's something tangible blocking the channels. So I think it kind of relates more to the channels than the organs, but that's been from my observation, and um, it's just what I've been trying to pick up. So let's just call it for the sake of simplicity, the Luo collateral system. Um, And I will also, as part of this, teach a little bit about an interpretation of the Luo collaterals that is quite nice. So I just look at this word first for Luo collaterals, and just here, this word is luo, and this is the word for when you have Jing luo. That's the Jing is the primary channels, and the luo are the channels that go out horizontally out of these vertically running primary channels. This is luo mai. So that means the luo collaterals. The luo collaterals are a really important part of the channel system. So they and they can get blocked. So they provide a kind of secondary network that comes out of the primary channels. So being able to perhaps do something with this from a diagnosis and then treatment is worthwhile. And just a reminder, we have Luo points on the primary channels. And for instance, lung 7 is the Luo point for the lung channel. So that's the point that opens and can take away stagnation in that Luo channel for the lung. So is that understandable? It's that's how we can treat that's how we can treat the Luo, and also you can press these Luo points to test whether you are seeing the manifestation of one of these blocked collaterals when you do the pulse. So I'll explain that shortly. Okay, so oh, that does not look good. Okay, I'm gonna have to. Karina, can you stop the recording? I am upside down. Thank you. Okay, no longer upside down. So the Luo collaterals are spread over a wider space than we normally think about. So my way of thinking about the Luo collaterals is if we were to have our primary channel running like this, let's say this is the lung channel going up. Oops, I've got to start the slideshow again. Let's say I've got here from lung 1 down to the end of the lung channel. And this is the primary channel. Well, halfway along it, let's say we have lung 7. All right, so that's the so-called Luo collateral point. The traditional way of talking about the channels just describes this tiny, tiny pathway of lung 7. I'm going to go to red, out to, just goes a tiny one out to large intestine 4. And then it also says that it spreads out into the thumb. So where I've done red is the traditional way that it's written. It's a really small, that's a really small pathway that is described. And I think it's quite, unsatisfactory, this description, because, I mean, you might just think, well, why would you bother? Why would you bother with this particular system? It's not very useful. I mean, when would you need to treat the base of the thumb? I mean, if this channel, all it does is run out to the base of the thumb and then spread out to large intestine 4, then that's not really doing very much. So there are other ways of understanding the collaterals, and actually Dr. Wang Ju Yi believed in this way as well. And that is that the collateral system basically follows the main pathway, but it just spreads out horizontally in a net. So the Luo collaterals are also sometimes called the network vessels in the classics. So they just spread. So basically, it spreads out wherever the channel goes. So when it gets up to lung 1, it spreads out over the top of the lung area, and actually it spreads out over and connects with the lung point on the other side. So it kind of makes a sort of mesh of surface channels over the whole channel. So if you just look at my image of me just for a minute, it runs across the top part of the lungs, And actually, I think this is really was really very important during COVID when people had long COVID symptoms, to realize that it might be the lower collaterals that could be involved. All the same, realizing that there's this kind of mesh going horizontally out of the channel is the best way of understanding the luo mai. Um, it's this is a good this is a good theory. Many of the descriptions in the classics do have this idea of going up the whole channel, but some of them don't. So I've chosen to illustrate this with lung because lung is a good example of one that has not got this wider mesh kind of description in the Neijing. So any questions about that? It's maybe a slightly different image to what you might have seen. Emma, are you asking a question? No? Thumbs up?
Sorry, Jamie, just a quick one. So the low collaterals are to connect to the other primary channel, the paired primary channel.
Yes.
So they're both.
Yes, it still is doing that connecting to the primary channel, but it is also doing this wider mesh. So in fact, you can think that one way of thinking about this is that over to one side, the other channel that it could connect to is running, and that it is trying to reach it by this kind of meshing motion. So it just makes a sort of more of a 3D version of what our channel system is. I think it's quite an exciting model, really. And it expands the idea of the channel system in a good way. And also it follows this idea, which you might have seen, that the vertical lines of the body are called the Jing, and then the horizontal are the Luo. So this is called the warp and the weft. So the Jing are the vertical channels for weaving, and the Luo are the horizontal ones that interlink. So basically, if you treat the Jing Luo, the Jing and the Luo, you're treating the whole system. You're treating the whole, like you're treating all of the channels of the body. And actually, I should just mention that from the small horizontal luo, there are also subsidiary small ones. And I think this is called the fu luo, the floating luo. So these are tiny, tiny collaterals that come off the main luo. So this is in a way a bit like a tree with vertical branches, vertical trunks and stems, horizontal big branches, and then small branches, the fu luo. So this is more like the luo that you can then see, which can get blocked with blocked capillaries and things like that. So you can see this. So the luo can be stagnant with blood, but I like to think of it as in a broader way, like stagnant of qi first. So it's just simply part of the qi dynamic that you've got this horizontal luo system. Yeah, it's kind of interesting. So this 9 regions or 9 pathways, as I'm changing it to, is for the diagnosis of the lower collaterals. And so sometimes it's also for the Jing Jin, the channel sinews. So if you were to imagine what the channel sinews are, the channel sinews run over which are big muscle groups, basically running over on either side of the primary channels. So they basically go right on top. So that's the kind of outer protection are these channel sinews. All right, so in green there, it's actually hard for you to see it's green, but this is green. So these are the channel sinews. So these run over the luo. So it might be that with this 9 pathways method, you've got a disturbance of the lower collaterals, or the channel sinews, or both of them together. The writer William Morris, who I think spearheaded this way of thinking to do with diagnosis in the contemporary time, just like in the last 10 years, thinks that this is for basically the channel sinews. He says that this is like Wei Qi and a Wei Qi disturbance, so a very kind of external disturbance that's manifesting on the pulse in the way I'm going to show you. So he thinks it's for the channel sinews. I think it's the Luo. I'd be happy for you to explore either of these. I think exploring is the right mode, rather than saying this is like carved in stone. You know, me and William Morris, Peter Ekman, and people from Shen Hammer tradition are all trying to make pulse diagnosis contemporary. So basically trying to take the classics and bring them into a contemporary framework. So I don't think any of us can really say that something is 100% a certain way. It's good for it to be more indeterminate, but with the emphasis on trying to explore in the clinic what's going on. Okay, so let's talk about how you're going to actually do this palpation. So before we were talking about, let's say in general, we're going to be talking about the left arm when we do this. So yeah, so before I drew this diagram of an artery, and just to remind you, then we divided it into 9 sections. These are all the places you can palpate with 3 positions, 1, 2, and 3, or Cun, Guan, and Che. And then you have sort of 3 lines that you could be talking about: the middle, and then the outside, and then the inside. So remember, this is for a right arm, and just draw a little hand to remind you what we're talking about. The key thing is where the thumb is. Okay, so sometimes we can use the word radial. Just give you some words for anatomy. We can use the word radial to mean that way, and that way can be ulnar. I prefer to sometimes use the word thumb side. Okay, when I say prefer, this is in teaching. And little finger side. But the important thing about this is that you need to be able to internalize it in yourself. You need to be able to visualize these things really well. So if you look at your own hand for a minute and see where the artery is, so look at your left hand, and then look to the thumb side of that artery, and then the little finger side of that artery. I believe that's easier than saying radial and ulnar, because you can just see where the thumb is, right? And you can see where the little finger is. So we need to be able to totally internalize these maps. So thumb side, little finger side is a bit easier. In the Mai Jing, they call this left and right. Okay, so that's a sort of that's a shortcut to describe the sides of the artery. All right, left and right, but it doesn't matter which, depending on which arm you're looking at, it could be either side. And incidentally, that brings up the question of how does the system actually come to exist in the first place? I think it might have been that at some point in the past, people only use one hand to do diagnosis. there are some images I've seen of people lying on their sides, like nobles lying on their side, and they kind of have only got one arm up. So it might be that they only had one arm they could use at some point. I can imagine even these tales of doctors being called in to treat the wife of the emperor, and they have to stick the arm out through a screen to do the diagnosis. So this might have been kind of thought, let's try and get diagnosis even from one hand, not even using two hands. Okay, so there's a possibility we're only talking about diagnosis of everything on one arm only. Either way, I think that it's an interesting model. We're just using the left hand here to talk about the sides, but trying to remember right now that we will be talking about the right side, and basically it's going to be a mirror image of everything we're doing. Okay, so we're still just talking about left for the time being. Okay, now where was I? Yes, I know. I wanted to show you from the exposition of the extraordinary vessels this diagram, which I think is super cool. To show you, it's not just me talking about this, but here it is, pulse positions from the hand diagram. Okay, so actually, when it says here, this is obviously in this book, exposition, but it says here pulse positions from the hand diagram of the Pulse Classic. The Pulse Classic is the Mai Jing, and the hand diagram is this book called Book 10 of the Mai Jing. So this is the original source of all of this information in about the year 200 AD, or Common Era. Okay, so here it talks about the distal position, the middle position, and the proximal position. And here you can see there are 9 dots there. So this is the thumb side, the middle, and the little finger side position. So there are 9 possibilities for this. And I think, yeah, I just want to show on this page here that it was also called in the original classics, for the lateral one, the thumb side is called Y, like outer, midline is zhong, and the medial inner one is nei. And you might remember that that triple burner 5 is called Y guan, outer. So Y means outer, midline zhong, well, zhong means center, and the medial nei. Nei guan is inner, so inner gate. So just try to remember those terms. It's just quite nice to know that there are different ways to describe this. So the radial one could be called Y, and the inner one could be nei, and the center one could be zhong in Chinese, or you could call it radial, middle, ulnar, or thumb side, middle, and little finger side. So I just want you to see there are these different words that you can use for this, but they all mean the same thing. All right. So from this little diagram, obviously you can expand this, and I will just show you now what does this all mean. Now remember that we're talking about the sides of the artery when we do this. Necessarily when I draw a diagram, it's not exactly the same as what you're feeling, but remember to feel this, you're bringing your fingers in at an angle, you're touching these 3 positions, and then hooking over and feeling on the inside and then going onto the top. So this is the, I'm going to write in what the organs are for this model. And I know in my book, this illustration is there on in chapter 2 of that book, but at the beginning of chapter 2 for step 3. Anyhow, so this is these are the organs. So we have bladder, stomach, and gallbladder. Okay, so these notice these are all yang channels, and they all start at the head, and they all run down to the feet, from head to foot. So those are the yang channels that are basically the foot yang channels. In the text, this is called foot tai yang, stomach is foot yang ming, and gallbladder is foot xiao yang. Okay, then what is described is on for the inner line, the nei line, or the ulnar little finger side, running from top to bottom, we have liver, and then spleen, and then we have kidney. Okay, now these are yin channels, and they are again foot yin channels. So they all go down to the foot. So this liver one would be called the foot shui yin. The spleen is the foot tai yin, and the kidney is the foot xiao yin. All right, so again, you'll be feeling it, feeling the top with the first finger, middle finger, third finger, and then hooking over liver, spleen, and kidney. Okay, so that's how you'd be accessing those things. So let's just pause this, not stop the recording, but just pause me talking, and I just want you to look at this. And could any of you make a suggestion for any patterns you can see between these organs? Can you see any patterns that help you remember, or in fact even anything that might help you remember this new map?
Feet.
That's all to do with the feet. Yes, they all run to the feet. Yeah, great. That's good. So these are all foot channels. So if I could just extrapolate what you just said, these are all channels. These are all of the channels that you find in the legs. So if you were to look at a leg, you would have all of those 6 channels in the leg.
On the 6 channel connections, I would have thought bladder would be at the bottom and gallbladder at the top, or vice versa.
Yeah,
because bladder and kidney aren't together, and liver and gallbladder aren't together.
I know, that would be nice if they were.
Yeah.
If you could just switch the liver and the kidney, that would be great, wouldn't it?
Yeah. So what's the explanation for that? It seems
yeah.
kind of
okay. So look,
counterintuitive.
It does a bit. Now, listen. By the way, I don't want to sort of protect this image as being like fantastic or super logical, but what I do think about this is that the kidney at the bottom. So if you look at the bottom right, the kidney at the bottom here is pretty cool. This is one of the findings that I started feeling the most, that helped me think that this was important. So the meaning of this is, imagine this pen I've just got here shows the pulse positions. If I've hooked over and I'm feeling what is the third position, the chirp position, proximal, this is normally kidney yin on the left-hand side. Okay, and I hook over and I feel the inside of that is even more yin, and that feels large on the inside. It's pushing out towards the tendon, which is just running here. Okay, so basically it's as if it's bulging out towards the tendon and it feels large. Then you could say this is something to do with the kidney luo collaterals, or the kidney sinews, or something to do with this kidney system running up towards the inside of the knee and then up towards the bottom, the lower jiao, and even into the lower back. So I think this is quite significant. So in a way, I'd like you to think that this kidney is correct, as it were, in the lower position. So this is kind of also, it relates to the kidney positions in the lower area. The one that for me doesn't feel logical is gallbladder being here, so to speak. But never mind. So that seems to be quite sensible. Stomach and spleen, okay, so they go together, but also this is in the middle jiao. according to the 3-jiao model. So this makes sense. Also, kidney is in the lower jiao. So that makes sense. I'm happy with that. Stomach and spleen in the upper jiao. Well, sorry, middle jiao. That's good. So so at least those make sense. Spleen and kidney. So maybe I'll just stop talking for a minute and see if anybody else has got some observations about any patterns that you might see here. Just trying to talk, I think. Oh, Ruth, did that help? Did that help at all? Does it make a little bit more sense?
Not yet, but I'm, hanging in there.
Hang in there, hang in there. Don't you worry. It'll come together.
Yeah.
Yeah. Emma, are you trying to say something, or are you looking at your?
Oh, sorry, my phone keeps slipping. I was wondering whether to or not, but I think it's probably a bit obvious. Just you've got the kind of their diagonal pairing. Obviously.
Yeah, absolutely. Well, no, that's good, because that is what I noticed from it, that there are these diagonal movements going across. So stomach and spleen are obviously opposite. So if you think about these kind of diagonal movements, stomach and spleen are opposites. Bladder and kidney are opposite, and gallbladder and stomach and spleen, you could say, are at the same level, or opposite. If you're talking about opposites, gallbladder and liver are opposite, and bladder and kidney are opposites. So that is what I noticed from it. And look, put it this way, all I try and do at the beginning when I learned this was try and remember it. I mean, whether or not this is a satisfactory map is another matter. But one thing to note is that we do, when we do acupuncture, already accept the normal 6-position map that we have of it being heart, liver, kidney, lung, spleen, kidney, yang. This is pretty much like, I've heard this so many times, I no longer question whether that is a valid map. But remember, that in itself is a, well, I mean, you could say it's arbitrary. Why are those organs on each hand? I mean, there are reasons why that is, but it is still a map. So this is a map, and in both cases, the map isn't the territory, it's just you're feeling things, and we need to make sure that the things we feel have some clinical relevance. So I went through quite a long period where I thought, you know what, this map is just not that useful, basically. But recently I just have realized it is quite useful. It's just useful to have another layer, and especially when you think it might be addressing different organs. It might be addressing not different organs, different systems. So in other words, in other words, this 6-position system that we know with with the normal six things. So heart, let's just do it like this: heart, liver, kidney, lung, spleen, kidney again. Or it could be triple, it could be pericardium, if you want to follow that way. So this normal so-called 6 positions, I think this is very useful for Zhang Fu. But basically, in other words, organ level dysfunction. So this could be thought of as the organs not happy. So you could say, if lung, let's say, is extremely deficient and spleen is slippery, then this means something. So this means there's some an overall tie-in disturbance with lung deficiency and dampness obstructing. So we've seen this kind of pattern all the time. When we see this map here, we potentially are looking at things which are more structural more physical, to do with the channel system, and kind of not necessarily connected to the organs. So it's a slightly different take on things. I look out for disturbances in with this map when I am looking for when I'm treating musculoskeletal problems. So I pay special attention for disturbances, and the best way to describe when something comes up is a disturbance. That's the best description of it. You're not looking for a huge thing. You're looking for a kind of smaller issue. So anyway, I think you've touched upon the main things. The 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 diagonalness of it is the most useful aspect of trying to remember.
Jamie?
I had a long. Yep, yep.
Sorry, does that apply on the other hand as well, or is it
Yes, it
different
does.
mapping on the other side?
It's the same, but it is a mirror image.
Yeah, but you've still got bladder, liver, stomach, spleen.
Yeah. It's just the same. It's a total mirror image.
And
Uh,
on those central ones,
oh
those
yes.
are the standard.
No, I'm
No?
going to do that.
Okay, we're coming to that
Sorry,
now.
they're
Okay.
not the standard.
Okay.
But it's anyway. I just wanted to break it down.
Yeah.
Show you these six. These are all, just to repeat, they're all foot channels. That the outer is yang, the inner is yin. As you might expect, the inner is yin because these yin channels are more on the inside. Anything more inside is yin. Anything more outside is yang. So that is kind of reasonable. So. I mean, maybe there's some logic to liver, spleen, kidney, as liver is found higher in the body to the spleen, stomach, and then lower is kidney. So this does have some anatomical kind of meaning, actually. And if you were to look at the head, I'm just kind of thinking aloud a bit, because I've often kind of wondered about this model. If you were to look at the head, theoretically, you've got the bladder channel coming out of the eye going upwards. Okay, so bladder is actually quite high. And you've got stomach. Well, it doesn't quite work. Stomach's going out there and gallbladder's there, so that's not quite right either. But I don't know. There's some sort of meaning. There's some sort of meaning here. Maybe it doesn't map 100%. So let me do the inner ones. And by the way, you'll probably see why when I've tried to teach this on a weekend course, at this point, I don't think I should have done this because it's basically too complicated. Okay. It's so difficult to have this as a new map when you've already trying to learn the other one. Okay, here we go. Into the middle. This is what's written in the Mai Jing. You have the heart at the top. Okay, now we're used to seeing the heart at the top because it's the emperor, right? So the heart should be at the top. And then we have pericardium in the middle, and then we have lung at the bottom. And that's the map. These are, okay, so what are all these channels? I will tell you, these are all yin channels, and they all go to the arm. Anybody noticing anything missing? What's missing?
The other yang channels.
The other yang channels, exactly. The other yang channels are not there. Okay, so some people say, oh well, it's not surprising the yang channels aren't there because you can't feel the back section here. So maybe the yang channels should be there because I mean, I think that's not a very nice argument. I think a better explanation is that you can read the yang channels as being here with the yin yang pairs. And that's a better explanation. Some people have said that in Chinese philosophy, they love the nines. They love the number nine so much that they were trying to make everything be nine. So there are like nine indicators. They used to talk about the whole body as being like a continent with nine regions. And the body started off as having, if you read the beginning of the Su Wen, it talks about the body has got nine orifices. Okay, the body has got nine holes that go into it. So like two nostrils, two eyes, two ears, one mouth, and then two orifices in the lower area. So there are nine orifices, and then that means, and that the body has got nine rivers, and that it supplies nine regions. So basically, this is like maybe a really old way of looking at the body as having these rivers, and that nine was the number that they used. So it might be that they started off as having this with nine, and in the text it's called nine pathways. So this is the origin of my title for this, nine pathways. So this the character here for pathway is I hope that I'm drawing this correctly. These are being not Dao. Okay. Is that somebody coming in or? Okay. Yeah. So Dao is so nine Dao is nine pathways. So this is Dao also means knowledge. So you could say this is like nine areas of knowledge. Nine areas of knowledge is a nice description. Nine pathways are the places that you feel, and I'll just tell you one further thing about this. The order you do it in is important. I'll just write it here. 1, 2, 3, 4, 5, 6, 7, 8, 9. Okay, so this is the order of palpation. And when you get used to doing this, your fingers will start to do this really quickly, like this. 1, 2, 3, 4, 5, 6, 7, 8, 9. Okay, so you just can practice this. So I'd actually like to ask you all to get out a pen or some kind of like object that you can hold out, and try practicing like this. 1, 2, 3, hook, 4, 5, 6, 7, 8, 9. So this is imagining for the left hand. 1, 2, 3, 4. 1, 2, 3, 4, 5, 6, 7, 8, 9. So that's the practice. If you want to hook over and do it on your hand, that's also fine. If you don't get confused by it. So the 1, 2, 3 at the beginning is with a pushing feeling. Push, 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 hooking, pull, 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 and settling on the top. 1, 2, 3. Okay, so I'll start again. Push, 1, 2, 3. So push 1, push 2, push 3, hook, pull 4, pull 5, pull 6. And then settling at the top, 7, 8, 9. So that's the order. And the palpation style is a bouncing light style. So you're kind of just bouncing on the artery. So it's quite important to try to feel where the artery is. So you will have already tried to do the 8 extras diagnosis when you do this. So you push from the side to do the 8 extras and pull and pull, push, pull, push, pull, settle, have a sense where the artery is. And I've described already that it might have a different shape, or it might be bulging at the top, in the middle, or the bottom. Okay, and then that is a sense of where the artery is. When you just touch on the sides, you can use really light pressure and sense if it is bulging in those little places, as if the artery wall is weak and is just kind of herniating out. But like if you have a sort of herniated disc, and I think this is the origin of this kidney one, there's a sense that you can sense something's pushing out for the rear part. Sorry. something's pushing out of the rear part of the artery into the kidney area. So that's the origin of that. So when you put your finger on top of it, you're just kind of touching it lightly and see if you can feel a bulge. So that is how you can pick them up when they're not very strong. If they are strong, they're really obvious. And that obviousness is just like the 8 extras. So that is probably almost time for a break. I have said a lot. So yeah, actually, let me just do a slight change of scene with this to give you a text that I want to show you. Okay. Well, first of all, to show you something that will look completely incomprehensible, but this is actually a diagram in Chinese of this system. And here it says the 9 pathways. And this actually is a diagram of a left hand with nine positions. And this also shows the 8 extraordinary vessels. So this is pretty far out, this this diagram. So anyway, I won't dwell on that, but this is chapter 17 of this book, and this is written like relatively recently. I think it was written in the 1500s. So it's from this book here, Amanda. Exposition of the 8 extraordinary vessels. And it basically recaps this chapter 10 of the Mai Jing. And this section here says, this is the same as chapter 10, book 10 of the Mai Jing. It basically says there are 9 pathways in this pulse reading. And then the writer, Li, starts writing. It says the radial wrist pulse is divided into the 9 pathways and provides an overall system. And this merges the 12 primary channels, that's the Jing, with the 8 extraordinary vessels. Each position has its own diagnostic presentation according to Chibo's secret teaching of the Yellow Emperor's Rhyme. So in the book I just read that they think that this is a text that is lost, and that was the origin of this system that is then recorded in the Mai Jing. So a old doctor, Bian Chui, said that you only needed to refer to the qi opening pulse. That means the pulse that is, so this is a really nice word they use, qi core. It means qi mouth. So in other words, this pulse is not just, sometimes it's called the inch opening, but this is called the qi opening. So need only to refer to the qi opening pulse to decide whether one will die or live. The qi opening is the starting place where the 100 vessels flow and converge in the morning. Although they pass through the 3 standard positions, the 9 pathways are submerged within it. Because nobody in the world knows the pulses for the 8 extraordinary vessels, I have now decided to draw a diagram of this pulse diagnosis system and append an explanation after it to transmit the secrets that have remained unknown throughout the ages. So isn't that nice? It's this writer saying that this is worth studying. So it's worth studying, and that this is also the origin of the additional map of the 8 extraordinary vessels. So this is the kind of, this is showing the Luo collaterals, or some sort of channel system that then is the basis of the 8 extraordinaries. Oh yeah, and the other thing to say about this book is that then in the remainder of that chapter, then he describes the findings, okay, on the next page, when we go into, let's say, the medial side, sorry, kidney, okay, directly on the midline of the distal position is the hand lesser yin heart and hand greater yang small intestine. So basically, Li has filled in the extras of the system. So he said it's also small intestine. And for me, that's a good enough explanation because this writer is the origin of how we do pulse diagnosis right now. So this is the other book he wrote, Li Jijian's other book, the Lakeside Master Study of the Pulse. This is the one that people kind of refer to. And this is the sort of standard origin of our standard kind of 27 pulses, like floating pulse. What is it like? You know, what does it mean? So this is the origin of our standard understanding. So I think that we should take him also at face value and use this incredible exposition about the 8 extraordinary vessels and think that this is reliable, basically, because he seemed to be an amazing practitioner. So that is where I'm going to take a break, I think, and I will I think what I'd like to do, if Ruth is still there.
Yeah.
Yeah, so Ruth, I know that you weren't, have you, Karina, can you stop the recording? Okay, so I thought it would be useful to do a brief recap about the whole of step B, just to show you where this is fitting in, and also to just give you a reminder, and then we'll carry on talking about this. So it's just worthwhile doing a recap. So step B has got do, ren, and chong. So these three were accessed, if you remember, through this vertical feeling going all the way down through the pulse from the top to the bottom. Briefly, very briefly, the top layer is where you find the do, the middle layer is where you find the ren, and the bottom layer is where you find the chong. And these should be felt as strongly vertically beating pulses, hitting your finger. So that's B1. Okay, so B2 then is for the remaining 5, and I also call this the 5 movements, because you're accessing it's the same grid as what we were just discussing for the 9, but you're finding this with sort of 5 different broad feelings. So the text of the Mai Jing 10 says, in the front position, from exploding or tapping on left and right, they use this word tan. And I've realized that this word tan they use is actually really onomatopoeic. It's a bit like our English word bang. Okay, can you see it's actually quite similar? Tan and bang. It means, so you could say bang. So you could say so this vessel at the left and right side, banging, exploding, or tan in the Chinese, this means the yang chao mai. All right, so that's the top one. The middle one, of course, you would not have this, or not likely to have this on one artery, this image. In the middle one, on the left and the right, banging or tan is the dai mai. And then the left and the right banging, tan, is the yin chao mai. Okay. And then it says, from what it says in the text then is literally And remember the diagram I showed you before? I'll write it here. It goes from Shao from Shao Yang to Shui Yin is, so I'm going to just draw it with black. From Shao Yang to Shui Yin, this is the left arm that we're looking at, is the Yang Wei Mai. So we've got 5 to count. Okay, just recap. Left and right at the top is the Yang Chao Mai. Second one, the Dai Mai. Left and right in the middle. The third one, the Yin Chao Mai. Left and right at the the proximal end. Then it goes from Shao Yang to Shui Yin. This is exactly what the text says. And the meaning of this is the same as what that map is that I just showed you. Okay? From Shao Yang to Shui Yin is the Yin Wei Mai. Oh, sorry, I did a wrong. Okay, cross that out. It's not Yang Wei Mai. From Shao Yang to Shui Yin is Yin Wei Mai. And number 5, got to draw it somewhere. I've run out of room, but it says, it goes the other way for Yang Wei. And this says exactly the opposite. And remember this map that we've got here. I'm just going to superimpose this map for a second. Okay, so just to recap, this kidney point here, all right, is called foot Shao Yin. Okay, and this bladder point up here is called foot Tai Yang. All right, in the text, book 10 of the Mai Jing. All right. So the Yang Wei Mai is described as going from the Shao Yin to the Tai Yang. And that's the movement. And that's the explanation in the text. And that's exactly what it says. And I believe I actually have that written out in Chinese. So I will just go back super fast.
So, sorry, Jamie.
Yes.
Question.
No trouble. No trouble.
I understand the words, but what does that mean in practice?
Well,
Like,
basically,
when you're saying
basically what it means is, sorry, go on.
Well, so I mean, okay, if you feel it banging on one of the 3 positions, you can say which that is. But when it's going from Shaoyin to Taiyang, what does that? Are you feeling it in the bottom right and the top left? Is that what we're talking?
Exactly.
Okay,
You're feeling it in the
go.
bottom right and the top left, and it's bulging all the way over. It's I'll just show you the words again since I just got this screen up. So if the pulse is, this is from book 10, from Shao Yang to Shui Yin, that's a Yin Wei, and then from Shao Yin to Tai Yang is Yang Wei. So literally that's what it's I think it's actually really easy to see this. I had studied like a little bit of Chinese when I started doing this, and even with a small amount of simple Chinese, it was quite easy to get to it. So yeah, basically what this feels like is a kind of bulging. Okay, I used this last time. So here is a kind of model of artery. All right, so for these ones that go over, they have a very particular feeling. And the way that you palpate them is to feel, you can check by actually moving your fingers at an angle and see whether the actual whole artery is not straight, but actually kind of at an angle. Sometimes it's very slight, but sometimes it really does a kink, like a big kink over. And another way of understanding this is as if the whole artery has been twisted. And you know, if you twist something, just look at my screen. When you twist something, it pokes up, doesn't it? So I'm just going to stop the share. So look, here's something that's straight, right? But when you twist it, it sometimes rises up. So this is, I'm going to make it do a yang wei mai from the bottom to the top, and it basically can go up. And can you see how the lines of it go up? So it's that's how it feels when it's really strong. And I shared with others the this case study.
You'd feel it
Yeah,
on
go
the
on.
top as well as the sides, presumably.
Well, you feel it on the you feel it okay, so let's say it's one of these, a yang wei mai. When you have your fingers, so this would be a left-sided arm and a yang wei mai pulse. When you feel it like this, your finger would feel it poking into your fingertip here. Okay, if you're just using your first one, it would be like way over. And when you come to the top, it would feel like it's disappeared. And when you go to the other side, it's like not there. But when you come back over here to the inside one, when you touch it, it feels almost like it's pushing your finger away towards the thumb. The middle position, when it's really excess, it's raised up. You probably may not be able to see that. So when you feel it with the middle finger, very lightly touching, it feels like it's pushing, the artery is actually pushed up. And with the rear position, it can, when it feels super twisted and excess, it's as if when you touch here on the side, it's trying to escape that way. And it can feel like quite an extreme feeling. It's very, very distinctive. So previously I've described with the Du Ren and Chong that it has this vertical and you feel it with all fingers simultaneously. This feels like the first finger is feeling at one side, the middle at the top, and the third one on the other side. So it's just like a twisted rope. That's the much more extreme version of it. So I showed the others this image. Can you see a whole screen?
Mm-hmm.
Yeah.
Yes.
Okay.
Yeah.
So this is from a Xiaoyin to Tai Yang is Yang Wei, and this is what the fingers look like. You may only notice it in the first position. So in a way, the finger on the first position is the one that kind of comes. Sorry. The first position is the one that often you feel it because it feels so off, but the other ones will be out of line as well. And this is how you can notate it, just with a kind of drawing 3 lines and showing this going out. But can you see now, I didn't mention this to you before if you were following this sequentially in the recordings, but this person has also got this, you see here I've written bladder luo, or jin means the sinew channels. So this would be meaningful that it's also the bladder sinew channel that it's pushing at. Here I've written bladder. So it's just so particularly intense. And this person also had I couldn't figure out what was going on. It also felt like a Du Mai pulse. He had a very bad back. And this was the fellow with the scoliosis, if you remember from last time. Obviously, some of you were not there. So this is what that back looked like. So it's a strongly scoliosis back. So this is an example of what actually the person was like, but there are lots of other things that the extraordinary vessels can be, other than physical things, but it does seem to pick them up really well. So there's the recap. Sorry. Let me find my screen. Let me just get off the screen.
Jamie, would you like me to pause?
No, it's fine. Emma, does that? I know that's sorry. Ruth, I know that was super quick.
Yes, no, that's helpful. Thank you.
Yeah, basically, it's well, just to explain, it's a larger version of what we're feeling now. The feelings of this map is a bigger. It's a more is going on. There's a these extraordinary vessel findings are larger. So if they're there, you won't be able to really feel these nine pathways very much. You can still feel them a bit, but you're mainly feeling the extraordinary vessel findings. But it's basically the same system. So that's why I was particularly pleased to have found that text I showed you before the break, where he said, because this is lost and it's useful, I think I'd like to bring it back. So I just thought it's actually really, I thought that's actually really nice because it's exactly how I felt about it. It's like really useful. It seems to be useful in practice, and that I'm finding things that are going wrong for people and able to help them actually with treatment. So, can we go back into my slide? You are recording now, Corinne, anyway. So, I will go back into the slideshow and describe that with when you are treating people, when you are you can test to see whether whether these channels are active, whether this is actually happening. So I'm just gonna just draw a picture of what this would look like in practice. So let's say I've got the person lying down on the couch. So the person's in red. Okay, and I'm going to do a little stylized artery here. Okay, and so I am thinking to myself that they've got some structural problem, and I don't know what it is. And they are, let's say, they've got okay. Let's say the main case is that they've got sciatica. All right, and they are also sort of describing the sensations of it, like somehow running over onto the top of the foot, which we know that sciatica could sometimes have this quality of like a train track going into the different from bladder to gallbladder to stomach. So we may be wondering what's up with this person? How is their sciatica manifesting? Okay, so when we then, with our fingers, palpate this left hand, and let's just say their sciatica is much worse on the left side, and it seems to radiate onto the stomach channel. All right, and when I say stomach channel, that's the general sense of the whole stomach channel as a channel sinew system. Now, by the way, actually, my mum had this recently. She kept on saying she had really bad Achilles tendonitis, but when I talked about it with her, it really seemed that her symptoms were more on the front of the leg and going into the front of the foot. So it's very paradoxical. So I actually used this method on her to check. So when we go on the outside, so you just got to remember, see this little section here? This is a version of what I was working on the previous one. Okay, so I'll just draw it facing up to begin with to show you the sections. The stomach channel is here. We might be interested in the stomach manifestation of this section. So that would be this part of the artery here. The outer middle section is for stomach. Okay, so with my middle finger of my right hand, I palpate that area, and if it feels like I've drawn it, as if there's something kind of active there and pushing, then you could then with your however you want to do your notation, sometimes you could do it with 3 lines. You could then do a little mark there that marks that as being the stomach area. Okay, so this is a left-sided stomach channel manifestation. If you then go over to the other side, to the right side, and palpate, this will be with your left hand. 1, 2, 3. If it was a right-sided sciatica, it would be there. But this is a left-sided sciatica, so that is not it. So this would be, this picture here, where I've just drawn, is a left-sided sciatica extending onto the stomach channel. Okay, super specific, right? And what's really cool about this is that you can test it. So what you can do is you can put your right finger on that left-handed stomach channel Luo manifestation on the pulse, and then with your right hand, you can start touching the stomach channel and find stomach 40, and you could press it, let's say with your thumb of the left hand, you could press stomach 40 at the same time. Stomach 40 is the Luo collateral point for the stomach. So you press that, and lo and behold, this excess feeling, even though it's small, can then dissolve. And then that's a way of testing that that is true. So then you can say, yes, this is true. You can, in your mind, you tick it off. You think, yeah, this was a finding that was a true finding. And if you then needle it, I mean, you can't always needle like this, because you'd have to needle with your left hand in this case. But occasionally I've had the experience, let's say this situation was on the other side and I was able to feel something on the right hand, and I'm needling with my feeling something with my left hand on the person's right hand. I can then needle with my right hand a Luo collateral point and get the feedback immediately that it's working. So this, for me, works on the person's right side, that I can actually do simultaneous needling. On courses, I've sometimes had the opportunity for people to feel the pulse changes whilst I'm needling, and they totally report that the pulses soften when the needling's happened. So it's a very exciting thing to do, and it's helped me be more sure of what I'm doing. Okay, so let me give you another example from the same system, if you can kind of bear having a new diagram. So, oh, thank you. So let's just say this person also had, this actually could easily be the case, that this kidney position was excess as well. So also they had a kidney presentation. So this happens. Now I know that there isn't an extraordinary vessel that would explain the kidney going out on one side and the stomach going out at the other. If the bladder position was going out as well, then that would look like a yang wei mai, but it isn't. It was a stomach on one side and the kidney on the other. So I have actually had this quite a lot, this particular picture. So that would be where these little blue marks are on the inside. So I can hook over and feel with my finger, my third finger, on the inside of this artery. By the way, are you following this? I hope it's understandable. Okay, so I can hook on the inside and feel that kidney position pulse, and then with my other hand, I can be feeling on the inside for I can test kidney points. Okay, and in this case, this is very easy to actually compare the two kidney points, which are kidney 4 is for the lower collaterals, but I do sometimes test kidney 5, which is the she cleft point, and I see which one of these makes this finding disperse more. And generally speaking, it's the lower collateral point, but occasionally it's the sinew point. So it's all fine. If the sinew point makes it go away more, then it might be a sinew channel. So that's why I was saying it's not carved in stone, this approach at all. It is something to explore. And in fact, I just need to say that this whole way of testing points to show channel changes itself, I saw some people doing on a course that I was teaching in Seattle, where some of the students started doing it. And that's because that was part of their method of testing points. So it just completely blew my mind. And I started using it after that. So it's interesting to realize that we're exploring pulse methods, and we can see what makes sense by things being better in the clinic. Okay, any questions on that? I covered quite a lot just there.
So,
Yeah.
sorry, Jamie, you said the so kidney 5, did you say it's the sinew point?
Yeah, so these points here, the kidney point is the sinew point, is the it's the she cleft point.
Okay.
And kidney 4 is the lower collateral. So you can test both of these with your thumb or with your finger. You can hook over and try palpating those points with your thumb on the key thing is to have your other finger on the channel finding, the pulse finding that relates to it. So your finger's on the pulse finding and your other finger is feeling for the point. And if the pulse finding goes softer, you know that it's the right point to use. So you can also use that for point location to get better point location. In this case, with my left hand, let's say I'm hooking over and feeling for kidney 4, and I think, wow, that's really made that kidney point, that's made the kidney pulse of this map of the 9 pathways go softer, and they've got this structural problem. With my finger still on that point, I'm pressing into the chi of it. I then get a needle and then immediately do needling straight into the point without taking my finger away from that point. So I just either with a guide tube or just take it away and put the needle straight in. So in a way, you get this immediate kind of way of getting feedback and needling. So this can be a very, very dynamic way of treating. I mean, obviously, this is the sort of thing I should show you in practice, right? But I think you can see that you can really take this to some good levels with extending your palpation and developing your palpation with the fingers on these diagnostic features. And by the way, the same can be said for the extraordinary vessels. So with your fingers on an extraordinary vessel finding, you can then press, let's say on the other side, they had a Mai expression that would look like this. Okay, really strong left and right. Your left hand is feeling this in the middle position, pushing in the middle position. Oh, it's huge. And then pulling on the middle position, it's huge. The right hand could then test gallbladder 41. And when you press gallbladder 41, which is the opening point, the dye, and it relieves it, then try and needle it immediately. And you can reach over with your needle in gallbladder 41. You can then be feeling whether it's making it go away. So you can even use it for needling. As you're pushing the needle in and out and you're getting de qi, you can then see what does the needling do to make the dai mai go away.
Jamie, how does this relate to excess and deficiency?
Well, okay, that's an excellent question because for sure, all of the things I've mentioned to you about these 9 pathways are excess findings. Okay, so they're all to do with accumulation of something. Um, so, for instance, an accumulation of let's just say we use this little diagram on the spleen channel, that could be for that could be a sort of accumulation you might have um, with let's say PCOS. So I've this is a reading I have found quite reliable that stomach and spleen on the edges, but more spleen is PCOS. So that's like dampness accumulated. So that is excess finding. For the extraordinary vessels, it's usually excess, but when the extraordinary vessels are still there, but they're a bit softer, they are more like deficient versions of their excess manifestations. But what this can't pick up are what sometimes people describe as deficiency findings of the extraordinary vessels. However, when I read in the classics about the nature of the extraordinary vessels, like for instance, this book I've been showing you, it doesn't talk that much about deficiency of those vessels. And even if they are deficient, I think sometimes they show themselves in an excess way because it's as if they're in trouble. So even when there's deficiency, I think that they're more likely to show as excess on the pulse. So I hope that describes for me the fact that I don't really know the exact meaning of deficiency in the extraordinary vessels, but all I can say is the pulses feel excess. So it's almost like it's showing the excess manifestation of those deficient things.
Um, okay, thanks. Also, you've in your description there of PCOS, you said it
Yeah.
could be excess in stomach and spleen,
Yeah.
more spleen. But how would you know whether that's a stomach spleen thing or a Mai thing?
Good question. So the I was thinking the same thing. So basically, the way I could see that that was a stomach spleen thing was that the whole pulse didn't feel excess when I first touched it. It felt more deficient. And when I tuned in really carefully, I could feel these little findings on both sides of the stomach and spleen position when I was touching the artery. And I was like really tuning into them. And it's like, okay, there's the stomach. It's maybe 3 out of 5 strong. And then here's the spleen on the inside. Oh, that's 5 out of 5 strong. But not, they didn't have like an explosive quality. So in the text, when it says the daimai, it says exploding left and right or banging left and right. It could be tapping, but tapping sounds less impressive. I mean, it's really this same word tan is the word they use for hand grenades and bombs and bullets. They are things that explode. So it's I think exploding out sideways is more appropriate. When somebody's got a strong daimai, it does feel like the artery is trying to escape out the sides. Uh, it's really, really noticeable. And that's the best way of starting with extraordinary vessels is look for these, look for these excess findings first of all, and then develop your senses so that you can find them when they're less strong and more deficient. Those more deficient sort of findings are similar to the similar more or less to the 9 pathway findings. So the other reason why this is hard to teach is that you need more sensitivity. So I definitely think this is an advanced method because you need more sensitivity and the model itself is super complicated. So you might say to yourself, is it worth it? But this example I showed you a minute ago, is a good example because with this person, when I did needling of stomach 40, it made a big difference to the case. So stomach 40 was a perfect point for their sciatica. So it showed exactly which channel point. So in other words, it's not just the knowledge. Like she said, she had feelings on the top of her leg, but she wasn't sure. But this is a bit like nailing it. In fact, when you then press a point that's like this, they're like, ah, this is really it. And it's like, great, okay, I'm going to put a needle there. Is that all right? Like, okay. I say, look, it's not going to be that bad. You know, a needle in the point that's the right point doesn't feel bad. It's a point that relieves. So actually, it's really good for them. So yeah. So basically, to answer your question, the more excess a pattern, the bigger these pulses are going to feel. But in themselves, these 9 pathway findings are less obvious than the extraordinary vessel findings. And if this extraordinary vessel findings are laid over top the 9 pathways, they will obliterate the 9 pathways. You won't be able to feel whatever's there underneath very easily. So yeah, so that's it basically.
And if you are feeling a deficiency, because
yeah,
especially, you know, I get postmenopausal women and sometimes I struggle to find anything, you know.
I
It's
know.
so
Yeah.
how do you mark a deficiency on your map there,
Well,
on
okay.
your annotation, you know?
Well, okay. So this system is not. You won't be able to pick up deficiencies like that.
Right.
I have. I mean, at least with my level of sensitivity, I'm intrigued when I read today in this exposition book, the author saying that, and this is in the Mai Jing as well, that not only do these 9 positions have got meaning, but also they have different pulse qualities in some of the positions. Like it says in one of them, if it's floating, it means this, or if it's sunken, it means that. And I thought, oh my goodness, how can it be sunken in this point? So I'm a bit like, wow, I that's not a level of sensitivity that I can manage right now. It's slightly it's slightly kind of nerve-wracking to think that that's what it is described in the classics. But just to come back anyway to where I'm at with it is not I'm not feeling deficient signs with these 9, okay? And anyway, the extraordinary vessels are not showing themselves in a deficient way. However, it just so happens then that it's not likely that there's going to be extraordinary vessel findings of an excess nature in this, as you described, somebody with a classic deficiency pattern. And I know exactly what you're talking about. You're talking about when you're hoping you're going to feel lots on the pulse and you put your finger on the pulse and you can't even find the pulse.
Yeah, exactly.
Yeah, it's awful, isn't it? It's very discouraging.
So, are you alive?
Are you alive? And they look up and they say, is there a pulse? And you're like, oh, I don't know what to say. But I can't feel it very easily. However, that's how some people are. So it's a sign of deficiency. I suppose the next stage of this ABC process, you're only going to be looking at levels. So the next stage of it is more suitable for deficiency cases because you're looking for how high the artery is in the space. So all become clear when we do this, but that is easier with deficiency cases because you're really saying is the artery there or not. You don't even have to use qualities. Obviously, you've got the general idea that there's deficiency or that they're deep. So those are what you'd pick up from step A, deficiency or deep or soft or empty. So that's already important. To be honest with you, sometimes with people where if I can't feel the pulse, it just means I'm going to have to use channel palpation and get all the information out of channel palpation only. So that's fine. I mean, it usually is the case that those people have got some quite good channel findings, because their deficiency sometimes causes their channels to back up in such a way that they often show in disturbances with lumps and nodules. So in other words, the channels still show something, but not the pulse. At any rate, I'm thinking they need the approach to be more related to tonification than anything else. That's an excellent question, by the way. It's good one. Emma, do you have a question? I see you reaching forward.
Well, I was I do struggle to know quite what I'm feeling with the pulse, but I was just having a feel as you were talking, and it's like I don't know whether I can feel on my kidney pulse what you're describing in the 9 regions, because it feels like a little kind of bead pushing out.
That's it.
It's slightly proximal to where I would think the kidney position was. It's kind of like at the side of my finger.
Yeah, it is on. Yeah. Okay. Well,
slightly past my finger, as it were. It's slightly on the. So it's just that whether I'm just not quite in the right position, but it definitely feels like that little herniated kind of thing. That
exactly. This herniated feeling.
Yeah, and it's quite small, like a little bead just pushing out.
Exactly. Well, that's exactly what this feels like.
But
that's how I started. It's that exact pulse that I started thinking I shouldn't ignore it, because it was I felt it on too many occasions, and there's a very strong correlation with back pain with that finding. So, and also it seems to help people a lot to then work with the kidneys. So it could be out of deficiency. There's at the root, maybe there's kidney deficiency, which is then causing this kind of loss of structure and then excess, some sort of relative excess in the channel. Yeah, it's something of huge interest to me, that particular finding, and I've worked with it quite a lot. So I like then treating the kidney channel, not necessarily just the lower collateral, but the whole kidney channel to try to ease that.
If you're doing this step B is basically the same left and right, isn't it?
Yes, exactly.
All bits of it.
All bits of it, exactly, like a mirror.
Yeah. So do you feel both sides?
Yes, you do. So basically, yeah. So I usually use the left first, and then basically, I don't know if you've ever had the experience of driving in the continent where you are used to driving on the left, and then you go to France and you drive on the right, and you do everything on the right. But this is like that. It's basically everything switches, and suddenly you're on the right side, and this map is like a mirror image on the right side. But all I can say is, don't worry. Somehow, because you've switched fingers and you've walked around the couch and everything's the other side, the wiring of your brain makes this work in a way that I think is not complicated. So it kind of sounds bad, the idea of the map being back to front on the other side. Do you know what I mean by the map being back to front?
Well, if you're always thinking about the thumb, then it's not an issue, is it?
Exactly.
Yeah.
Somehow it works that you go round to the other side, and it's all the other way around on the other side. It's quite cool, actually. So, yeah. So basically, you go to the other side, and well, for instance, this map here I drew of the person with the left-sided sciatica is a good example of something that's not symmetrical, because they had. I mean, let's just say, actually, by the way, I'll draw out on the notation what I drew there. So that's stomach and kidney. So this, actually, I've got a patient who has, I'll just draw exactly what my patient has. This is my long-standing patient with knee pain. Left-sided knee pain. Now, I've been seeing her for donkey's years. It's really, she's always got the same condition of knee pain, and her pulses always say the same thing. On the right side is not so bad. Maybe it's just on the spleen. Okay. So this is what the right side would be. So the map is literally just reversed with bladder, stomach,
Gallbladder.
Thank you very much. My brain is melted down. Liver, bleed. Spleen is always in the middle, right? So that's easy. Yeah, it's just flipped onto the other side. So this is the right side, not so bad. Left side, it is bad. But then it's really nice using the lower collateral points on her because I've just got the sense that I'm easing her channels as well as everything else I'm doing. I mean, so I use the collateral points like that. Yeah, it's a super system. It's yeah.
But then it goes off again. Why does it keep going?
Because she's got arthritis. I mean,
okay, right.
She's never not going to have this.
Yeah. Mm.
In fact, she's had a knee replacement and it's the same.
Mm.
And she's still got pain.
Mm.
So it's interesting. I'm keeping on treating her. I mean, not everybody who has knee replacements continue to have pain, but she is one of those types of people who does. She's 72. It's just not shifted. So I am no longer getting disheartened by this. I've seen it work also positively for people. And at any rate, I only see her once a month. So it's not, it's a little bit unfair to think with somebody with chronic arthritis that we will help overturn their condition, but at least I've got the sense that I'm easing their condition. So,
yeah.
Wasn't her operation deferred for quite a long time as well? Because
yeah, well, basically, I have treated her for 18 years. So I treated her when I wasn't doing acupuncture. I first of all did shiatsu and tuina and anma at the time. And she managed to not have her operation for 10 years as a result of having monthly treatment. So basically, every few years she went back to the specialist and he was like, no, it's not bad enough yet. I don't know what you're doing, but it's all right. Not that it's perfect, but basically she didn't want to have an operation when it was not really bad. It was only when it was really bad that she had an operation. But I'm sorry that it's actually still pretty similar, her picture. But ho-hum, that's the way it goes. Yeah, but with different people, these are useful, including tracking for PCOS has been something which I've taken quite a lot of. It's been very interesting seeing the PCOS changes actually. And that has been very, very easy to feel. And with the notation. So by the way, this way of notating it is like with a picture. The other way of notating it would be like this, with B1, B2, B3. This is with all of the ones. So we'll have done A's and the C's below. But with B3, with a PCOS lady, I think I have started saying stomach 3. That's 3 out of 5. Spleen 5. And for her, it was like kidney 2. So that for me is my next level of this, is putting values to how big it feels, where 5 is the biggest it could be. But I'll be honest, she's the only person I've managed to do this with. So I feel like I'm studying this myself. And I'm finding it really interesting. This was bilateral, okay? So it's exactly the same on the right side as well. So it made me think that this was not to do with the organs in the traditional way, that this was, well, I mean, it's a slightly different system.
Well,
yeah, this lady had blocked fallopian tubes, I think. Yes. So she's got blockages as well. So that's continually being blocked and she's got PCOS. Anyhow, so interesting, right? So, okay, so just to give you a super quick resume about this, I have gone over these 9 pathways, and I guess I'm trying to share with you the fact that this is not that easy to do in terms of being complex. You've got a new map, and it's a little bit sensitive, but as Emma said, she found something, and I have found it quite useful in practice. The other thing that's useful about it is that it relates to these 5 extraordinary vessels that aren't the Du, Ren, and Chong. So there's a direct correlation to the meaning of those the findings there. So it's quite exciting to work with both of these systems. The extraordinary vessel, I'd leave you with some sort of things about this. The extraordinary vessel findings are easier to feel than these 9 pathways, but these are worth persevering with. So it's kind of like going into this system as deeply as you could, really. So that's probably where we'll leave it, but I do want to see if there is any other questions from my useful question askers.
So Jamie, this may be something I just need to go and have a better read about, but I'm just still not quite sure if I've got the relationship between extraordinary vessels and these 9 regions.
Okay.
I missed the bit when you started talking after 11. I missed that bit. So
no, it's fine. It's fine. Let me look. I've got time. I'll quickly go back to some other things. I'll just go back to this.
Thank you.
Okay. So now what are you seeing? Oh yeah. Okay. That's fine. So okay, so let's say we were looking at in fact, let's just go back to I'll start with a new piece of paper. It's a good question, by the way. All right, so we're just start with a fresh image of the 9 places, and let's just look at the middle section for the time being. And with the middle section, with the left hand, you've got stomach. Sorry, yes, left hand, stomach, pericardium / triple burner, and spleen. Okay. Now, when you have a Mai headache, or a headache that is often characterized, that I find, which comes out with the Mai. So just to say, with some of these Dai presentations, when you read the classical things about the Mai, you don't often think about headaches necessarily, but I see there's quite a strong correlation with headaches and the Mai. All right, so often it comes out the sides of the artery in this very, very strong way. And also, these places are related to the stomach, the spleen, and also the pericardium and the triple burner. So when there's a strong Mai headache, which is kind of a bit like a migraine, the systems that can also be affected are things like the spleen and the stomach, with kind of maybe nausea or lack of appetite, or it can cause loose stools. This Mai, when it's very, very pronounced, even goes up into the middle section. So it's as if it's pushing out in all the directions you can have. That sort of seems to then relate to the pericardium and triple burner. And actually, I have a case study. If you've got the time, I will go to a case. Let's see it. My tinnitus case. Yay, great, because my tinnitus case that I had was the only time I've managed to treat tinnitus. Okay, so keep this image we just had in mind, and I'll just go to my case notes and show you my tinnitus case. All right. So, okay, you can see it. All right. Okay, bear with me. So here is the last time I had seen her. So basically, this tinnitus seems to be triggered by having cold and being run down. And she, I had treated her for a number of times successfully with points. Like, let's see, the last time I treated her was triple burner 5, gallbladder 41, heart 7, kidney 7. So I'm just gonna, that basically is a shorthand for a Xiao Yang kind of treatment, maybe a Dai Mai or maybe a Yang Wei Mai treatment that also nourishes the Xiao Yin of heart 7 and kidney 7. As I say here, nourishing kidney qi, essence to allow the 8 extraordinary vessels to relax. So that's the kind of big picture of what I'm doing with her. So she thought she was done anyway. Then she came back later, had a virus, it triggered high pitch. And let's just have a look at the what it looks like with the last session. Oh, actually, this is what the last session looked like. But anyway, it just shows you the notation. So the last session, which actually had those points that I used, was like this. Wire it. So look, this actually shows you my whole system. I'll just separate it so it's easier to see. So A1 is wiry, slight worry, hollow. This is all on the left and 3. On the right, 3 and quite rapid. The middle jiao is full and the upper jiao and the upper layer is full. Okay, so that's from step A. Then in the step B, on the left side, I thought she might have a Ren pulse, but I wasn't sure. Okay, and in fact, that can be discounted because the other things are more important. On the left side, she had a Dai Mai, really strong all the way around, including the front, which means that pericardium triple burner position. On the right side, she had a Yin Chao Mai, which means the rear position was full in left and right. It's a bit like a Dai, but it's on the third position. Then for the Luo on the left, the pericardium, the spleen, and on the right, the spleen. So I was still able to feel these 9 pathway findings. I hope that's not too confusing, but it shows you that it is still possible to do some of these things, even when there are extraordinary vessels involved. So yeah, and these are the points that I did then: triple burner 5, gallbladder 41, and heart 7, kidney 7. So nourishing the kidney, allow the 8 extraordinary vessels to relax. So bear in mind that so basically it's showing these things are there as well, where how those relate to her pathologies remains to be explored, but the pericardium pulse is also for the triple burner, so that relates to her tinnitus, and I think it was left-sided tinnitus. I mean, the tinnitus was only in her left ear. By the way, her other findings, which relate to step C, just remember this for Thursday and next week. Her heart pulse was down and her kidney pulse was up. So this means a Xiao Yin picture. That's also why I did. So these are the points I did relating to it. That's why I did heart 7 and kidney 7 for rebalancing the Xiao Yin. Whereas for this Dai Mai, okay, let's say I ignored the Yin Chao Mai. The Dai Mai made more sense for something I was going to treat. I did Xiao triple burner 5, and gallbladder 41, which are the classic opening and coupling points for the Mai. So that's why. Anyhow, what she had said,
sorry.
yeah. Well, just to finish, I was going.
Yeah, go on.
Well, just to say, one of the things that was really key about her was that she said that she had lost she was feeling depressed as well. And in the previous sessions, the key thing that she said that made her feel that she was getting better, that she was able to pick up a book and read her book again, whereas she had lost the ability to read because the noise was so bothering her. So I thought that was really significant, that she felt better in herself. You know, there's this classic phrase, you feel better in yourself. So she felt better in herself because she was able to read, and then it restored her inner life, you know, her creativity and her inner life. So I then encouraged her to do more creative things and, you know, talked about other lifestyle stuff, but like relaxation. But, you know, I just thought this is a really interesting multi-dimensional case. So Ruth, your question.
I'm just looking at B2 and B3 there.
Yeah.
So dye is full left, on both sides and
Both
on the
sides.
top of it, you're
Exactly.
saying?
Yes, and that was what I was trying. That's what I remembered this case when we were talking about it a minute ago. That sometimes the die is all the way around,
Yeah.
but it's actually like a belt. It's actually what the Mai is like when when it goes all the way around the body. It's like going all the way around the pulse, and it's almost affecting the channels that are inside it. So,
But then when you go on to B3,
yeah,
you haven't got the stomach in there, but that's the same position,
no,
isn't it?
it's the same position, but I just noticed I mean, basically, okay. So basically,
I'm
let
just
me explain
wondering
what I
how they're
do.
different, how you're feeling different things depending on
I
what's
know,
in your head,
I know.
basically.
Well, so basically, what I do when I write down the okay, so imagine you haven't got the bold
Yeah,
writing
sure.
paper. I just added, right? So when I write this down, let's say I'm on step A, and I just did is wiry, is hollow, quite rapid, middle jowl, upper jowl is full. That's just like impressions from the first step. So I try not to interpret it. I try to let it all be there in a kind of fluffy, just write it down, feel it and write it down and think about it a bit, but don't think about it too much. B1, is it Ren? I just write it down. Okay, I did a question mark, but I kind of wrote it down thinking I don't think it is a question. I don't think it is Ren. In fact, it was the die and the other things were going on there as well. Left-sided Dai, right-sided Yin Chao Mai. So you've noticed it's sort of is a bit treated with the kidney and heart, but not exactly treated. And then these are our findings. Left-sided pericardium, triple burner, spleen, right-sided spleen. I don't know what it means. I wrote it down because I could feel it. So part of my process is don't worry, write it down, see if you can make a treatment principle out of it, or check this now with channel palpation, which is my other way of doing diagnosis, and seeing, well, maybe some of these things will be out in the pulse. Maybe the spleen channel will be lumpy. Maybe that's worth treating at another point. I don't know what it means. So, this also gives me the rationale for thinking that treatment is not done in one go, that it's many layers of treating somebody, and that things change. And I would like to then see these excess findings going down, and then maybe those things on these things maybe become more obvious of the collateral system. Or maybe she's got bad knees. I can't quite remember. So it's basically worth writing it down. And in fact, sometimes anyway, it may not be correct. It may just be that I misdiagnosed it. But at least if you get into the process of, it's a bit like brainstorming. Don't reject things because it doesn't make sense. Get it all down. Get down your impressions. It strengthens your ability to feel and then produce something that's realistic, that's real diagnosis. I believe that this model that I've described today was rejected in later times because people thought, I don't know how it makes sense. How can you have these 6 positions and this 9 thing in one go? So therefore, it was just chucked away. But in fact, it doesn't mean that it's not useful. So usefulness is the bottom line. If it's useful, I mean, for me, I want to be able to teach it as well, right? So, but if I could teach it, and if it's useful, then it's worth using as a method. If it's not teachable and it's not usable and not bringing anything, then there's no point having it. But this is, maybe it's an even experiment on my side to teach it, but I've kind of I saved chopping it out earlier about 2 years ago. I was like, I think I'm going to get rid of this step. It's a nightmare to teach it quickly because people can get very confused. But this is why doing this recorded seminars is an interesting thing in terms of education, and is that we've got enough time to go through the background of it, and then think about it. And then basically what I'd like to ask you guys to do is just try to work with the map, maybe draw out the map, and also practice using your fingers in that order, that palpation order, the 1 to 9 positions, because that kind of is the background thing to do to make it work. So did that answer your question?
Yeah.
Good. I mean, there's a lot to it. I mean, then there's the question about whether you're feeling in the midline ones, a midline pulse finding, or are you feeling them on the standard positions? And I can't remember I can't remember if somebody actually asked me that in a seminar, but I do remember wondering it myself. And the answer to that is that these Luo collaterals have got a kind of floaty, Emma said it's like a bean. Sometimes it feels like a bean, like a herniation or a bulge, or it's got a kind of soft spot where it's just kind of like a water balloon or something like that. It's kind of like vibrating and moving. So it's got a softness to it. So, you have to kind of, when you palpate, you have to kind of almost bounce on the artery to sort of say, oh, is there one here? But when there is one, it kind of pushes back at you. So you can do it quite quickly, this thing. Basically, when you do step B, the way to do step B to begin with, if you're not sure, is go through these 9 positions and thinking about the 9 collaterals. So it's almost like a method of doing 1, 2, 3, 4, 5, 6, 7, 8, 9. Are any of these 9 pathways there? And if there's an extraordinary vessel, you'll feel it when you do that. The extraordinary vessels will just impinge on your consciousness. It'll be like, whoa, there's not these 9 things. There's a big twisted rope in here. Mm-hmm. What is that? Is it a do? Is it a yang wei mai? Is it a dai? Sometimes you have you get overwhelmed with impressions. If you're doing something really sensitively and you expect it to be soft and it's not, and it's excess, it really almost like blows you away how strong the impression of that is. I think we're going to have to leave it pretty soon. Emma, one more question.
So just on your case study there, so
yeah.
So why were the extraordinary vessel findings unilateral?
Oh yeah. Well, this is the other thing that's so interesting, is that you can have unilateral findings. And okay, I can't resist but show you. Sorry, if you've got time, I might as well. We're recording this. If anybody is exhausted, they go and do something else. But okay, this is the puzzle of the extraordinary vessels, and I think this is kind of interesting. Basically, why is it 31? Why do they use this number 31? And basically, the answer to it is that you have got 3 extraordinary midline vessels, which are the Du, Ren, and Chong. Let me use a pen. Okay, the Du, Ren, and Chong, that's 1, 2, and 3. Okay, so those are 3, and they're on the midlines, and very often they're just found. There's only one of them to find. Okay, so they're not generally thought of as bilateral. That's not carved in stone, though. I do sometimes find unilateral versions of it. So this is what we've been looking at a little bit more today, B2 and B3, and basically the 5 bilateral extraordinary vessels of the yin wei, yang wei, yin chao, yang chao, and the dai make 10 pulses. Okay, on 2 hands, that's 10 signs. And then the 9 pathways, okay, that's 9 findings on 2 hands is 18. So 3 plus 10 plus 18 is 31. Ta-da! So there have been a lot of people trying to figure this sum out. And I believe that only by considering it, the key thing, why is it important, is this, on 2 hands. So the 9 pathways found on 2 hands and the 5 bilateral extraordinary vessels found on 2 hands mean you have a possibility of all these different readings. And that, I have heard some scholars say that the reason why they use numbers and the reason why they use poetic language in the classics is to encode information. And here is this information. There are they use the number 31, and they must have realized that there's only one way to come up with 31. Only one reasonable way to come up with 31. I mean, it's a weird number. It's a prime number. I mean, can you ever imagine doing 30-something 31 times? I mean, it's almost unworkable, isn't it? 31. But that's the number they chose. And I believe it encodes this information of the two-handedness of it. So that's why you could easily have, and I often have this, Ren Mai on one side and Yin Chao Mai on the other side. Or, you know, other combinations where there's something bilateral going on. You could even have on one side Yin Wei Mai, and on the other, on the right side, Yang Wei Mai. Sorry, that was the other way. Let's say left-sided Yang Wei Mai and the right-sided Yin Wei Mai. That's what it would look like. So I have had this with some people with very bad back patterns, and you know, you could imagine this is not a very good sign to have something different on each side that is so opposite. Sometimes you have Yang Wei Mai on one side and Dai Mai on the other side. So that's another option. Okay, I think we better stop talking, or we all melt. All our brains melt down.
Yeah.
All our brains melt down. But anyway, enjoy going back over this. If you've got my book, this is also described in my book, and also I think with the case, I think we've got notes for the Karina. We've got notes for the tween-hour course on this, and for the other courses that this webinars relate to, we will be providing notes that are to explain all of this for people who've never done it before at all. So that's where we'll leave it. So this will now feed into just a minute. This will now feed into step C. So step C is going to be all about the Zhang Fu and about emotional stuff as well. So this kind of feeds into it. Emotional stuff, the world of the elements as well. So that's nice. It's a nice segue because that's kind of in a way a completely different world. Okay, so
cool.
Have a nice rest of the day. Enjoy the sunshine if it's sunny there.
Great stuff.
You're welcome.
Yeah.
Great to have you.
Everyone.
Thank you for your questions.
Thanks, Karina.
Thanks a lot. See you soon.
You're welcome. See you soon.
Bye.
Bye.
Bye.